In that clinic, we are providing integrated services for our patients. We never had a harmonious sort of relationship with the government. We didn't know even what to report to the government, and even we didn't know what the government really wants us to do. There was a gap.
Around the mid-90s, the private health sector in Ethiopia grew exponentially to almost equal the government's capacity, but it remained invisible to health policy makers, planners, and decision makers.
There was no any mechanism by which the private health sector can participate in public health issues, in national health agendas.
The entire healthcare system, planning, execution, etc., was done by the public. The private health sector can assist the public sector in various ways where there is human resources constraint. Half of your capacity for healthcare delivery is in the private sector.
It's assumed by many that private clinics are meant for the rich and for the urban populations, but the evidence on the ground is contrary to this. More than 45% of the rural populations, they utilize the private health sector. Close to 50% of the poorest of the poor population utilize the private health sector.
In 2009, USAID funded the private health sector program. Its primary objective is to support the Ministry of Health and the regional health bureaus to provide affordable, high-quality public health services through public-private partnership.
PHSP created the platform where the private health sector can engage in national health agendas with the government to utilize the potential in the private health sector in terms of human resource, in terms of infrastructure, in terms of diagnostic and treatment capabilities.
Private health sector program was set up to expand scope and geographic coverage. The scope increased from just TB and testing HIV to TB comprehensive HIV, which includes pre-ART, ART, and PMTCT. And this program also included family planning, STI, and malaria. You have to train the providers because they have been sidelined and therefore they don't know the basic care of tuberculosis, HIV, etc.
PHSP has been providing trainings for financial staffs, the admin staffs, and even that of the healthcare providing staffs. And because of that, the service has been expanding. These services used to be offered only in public setups for our patients, but thanks to PHSP, we have integrated these services.
Once the capacity is built and the service is delivered, then we support them through a continuous quality improvement.
The supportive supervision was being implemented jointly with the Regional Health Bureau, as well as professionals from the Zonal Health Department and the respective Warada health offices. So it was a joint supportive supervision program.
We all are doing same thing at different levels and at different centers in order to achieve a similar goal. And there is a goal set by the government, and we feel that we are contributing a huge thing. We have become their partners.
Formerly, we were referring patients after we diagnosed to the public sector so that they can get the treatment. But now, if the patient is interested to stay in our facility, they can get that service in our hospital. All this has been started because of PHSP.
Our approach to implementing these programs is designed in such a way that there would be regional ownership, and at the end of the life of the project, that successfully implemented programs would be sustained by the regions.
Now we have seen that the regional health bureaus trust the private health sector. We have created, a very good understanding between these two groups, which used to be rivals in the past.
Private health sector program has indisputably demonstrated that the private health sector is an integral part of the nation's healthcare delivery system.
The relationship generally between the private and the public is improved, and that is one of the greatest achievements of this project.